Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan. Welcome to the show. We're here with our co-host, Dr. Ruvain Rubenstein out of Troy, Michigan.
How you doing?
And our returning guest, Dr. Sarah Rubenstein out of Troy, Michigan as well.
Hi.
So last time we had you on the show, we talked about chiropractic during pregnancy. And we see that the baby is still in, and I assume you're still under chiropractic care during your pregnancy.
I am.
All right. And we talked about how effective and gentle chiropractic care can be during the pregnancy and how there are not contraindications, which many people believe there are, that they can't come in for chiropractic care during a pregnancy.
Absolutely. I mean, chiropractic care is safe and effective for the pregnant mother and for the fetus inside. I mean, we're just making sure that the body's properly functioning. And another good thing that we can do is, a lot of mothers already have their OBGYN picked out and stuff, is co-manage with them to make sure that everything's properly functioning. Go to them as well, and we do a lot of referrals back and forth with OBs.
Absolutely, and as doctors in general, communication is great with all the different specialists, and that's one thing that I pride myself on, is keeping great relationships with all the specialists in our area and co-managing patients as well as possible. So a lot of people may believe that their OBGYN may not want them to have chiropractic care or things like that, or that in general, once they're pregnant, they can only be under OBGYN care, and that's not the case at all. I work great with most OBGYNs around the area and have great relationships with them, and we can co-manage them, send them records, anything that we need to. So we have a little video clip of myself talking with an OBGYN about chiropractic during pregnancy and how that we can work together.
Co-manage.
So we'll play the video clip.
Hi there, this is Dr. Adam Rodnick, chiropractor out of Commerce Township. We're here with Dr. Neil Brickman.
How you doing?
He's an OBGYN out of West Bloomfield, Michigan. And we were talking today about chiropractic during pregnancy. We know that as the baby starts to develop, it pulls a lot of pressure on the lower back.
Yes.
Do you see a lot of women develop lower back pain and symptoms during their pregnancy?
Yeah, a lot of women come in and complain that, oh, my back's sore, this is uncomfortable, is there anything I can do about it?
And we see that there's a lot of common misconception. We hear from some people thinking that if they're pregnant, they can't be under chiropractic care or can't have chiropractic adjustments. And I know we do a lot of work with you guys, and what do you do?
Yeah, definitely recommend for women that have a lot of back pain to see a chiropractor. Sometimes they can help adjust them. They might need some physical therapy. It's kind of get in the right direction.
Yeah, and obviously anything natural at that point is going to be better than anything more invasive or any medication during the pregnancy.
Yeah.
Right? And so we work with a lot of women during the pregnancy for their lower back pain, and also we have some techniques that we can do. The Webster breech technique that can sometimes help to turn breech babies. So we work with that a lot too. Do you see a lot of breech babies?
We don't really notice a breech until towards the end. We don't really screen until like the last month.
Gotcha. And that's just something we'll usually check for with the hips and the pelvis. If we see women that are during their pregnancy, we'll kind of check that all the way along when they already have lower back pain and things like that. And so thank you for joining us, Doc.
Oh, my pleasure.
I look forward to working with more of your patients.
My pleasure.
Absolutely.
So that was Dr. Neil Brickman out of West Bloomfield, Michigan, OBGYN who's delivered thousands and thousands of babies, and he sees as well that a lot of women during pregnancy have back pain, and that by sending some of his patients to us as chiropractors, we can really help with that, and we can help along with the pregnancy.
I mean, the best part about co-managing with an OBGYN is our goal is for the patient's well-being. I mean, if the patient's overall well-being is better because we can co-manage with an OBGYN, getting chiropractic care as well as being monitored by them, you can't beat that. That's the best possible outcome. I mean, that's what our mission is as doctors, is to take care of the patients and to our best ability. So
Absolutely.
whatever co-managing or
And communication is important. It's very easy these days to communicate by fax, email, phone call, just sending records. It's very easy to communicate.
with electronic health records these days, I mean, we can just send all the records, boom, they can send it right back to us. We have them, so it's really easy to co-manage these days.
Let's continue with after the pregnancy. After a baby is born, how early should somebody or a spine be under chiropractic care?
With our children, it was within a few minutes of birth. How old were your children?
The same thing in my household, absolutely. And so a lot of people think chiropractors are just for people with excruciating neck pain or back pain, and obviously we have some great results with that, and we see hundreds of patients with those type of symptoms. But I like our patients to think of us like a dentist for their spine. Kids start brushing their teeth and trying to keep their teeth healthy as soon as they have teeth. Kids should start keeping a healthy spine as soon as they have a spine.
Exactly.
And they
Absolutely.
have a spine throughout their whole life cycle. Most people don't think about their spine until what?
Till it hurts.
Till it hurts. Now maybe they're in their 20s, or they have a sports injury, they're 10, or they are carrying their backpack too heavy, or they're 30s, 40s, 50s. And now by the time we take a look at their spine, we see degenerative changes, we see bone spurs, we see some irreversible damage that may have been prevented
If they got adjusted earlier.
if they were taking care of their spine throughout their whole lifespan. Just like the teeth. If someone never went to a dentist, never flossed, never took care of their teeth at all until they started to hurt, well, now they're going to have cavities, they're going to be rotting, their teeth are going to have changed shape, all sorts of different things. It's going to affect their overall health. And same thing with the spine. By the time someone has a lot of symptoms,
It's too late.
structure has been there poorly for years. I like to think of symptoms kind of like the tip of the iceberg. If you look at an iceberg, the top of it is above the water, underneath the
90%.
bulk of it is below the surface. And so it's kind of like the check engine light in a car as well. You know, if you have the check engine light come on in your car, most people probably just ignore it.
Sticker
but obviously,
over it.
yeah, obviously it's better to go and get your engine serviced. Same thing with symptoms. By the time a kid, a teenager, or an adult starts to have symptoms, there's an underlying structural problem for a long time before that. So we encourage people to keep their spine healthy their entire life cycle, not only when they have symptoms. So even if they go for periodic, or even whether it's regular, semi-regular, or even sporadic or very periodic checkups to the chiropractor, can absolutely help improve the lifespan of their spine, because you only get one.
Absolutely. I mean, you asked when should a baby first get adjusted? Like we said, our children were born and adjusted right away. I mean, I adjusted my daughter at a minute old. They were cleaning her off. I adjusted her. She fell asleep right there on the table. Cutest thing ever. But the reason that you should start getting adjusted right away, I mean, people are like, oh, misconception of back pain, neck pain. I mean, a little baby can't tell you they're in pain. But I'll tell you one thing, if we check and we find something wrong with their nervous system, they're not going to grow and function to their best ability. And it all starts, one, we want to make sure they're getting checked, the mother's getting checked while they're pregnant with the child. But I mean, when the baby's coming out of the birth process, it's a pretty traumatic thing. I mean, think about a baby coming through, it's a pretty traumatic thing. We don't have to get into the details of it,
okay.
and then
You're taking some of that
everyone
baby
knows.
out
I
of
mean,
that birth canal.
exactly.
And it can be rough and traumatic, obviously on the mother, right?
Absolutely.
So-
But even on the baby, there's a lot of force going on to get the head to corkscrew,
Yeah, I
get
mean,
the
yeah,
shoulders out.
the baby-
And so it can be a lot of force on the newborn spine. Now, of course, a baby's bones are a lot softer. So their spine is more pliable, more mobile. Their skull has not fully fused in the sutures. And so that's why the baby's head can really mold, but it's still a lot of trauma and a lot of pressure on a baby.
Yeah, I mean, adjusting a baby, why not check it is why I think. Why not go to a chiropractor, someone who specializes in checking people's nervous system? Adjusting a child, okay, it's a traumatic thing, and all these symptoms can start occurring, but it's so simple. It takes 2 seconds to check and analyze a newborn baby. Their bones are soft, so to put them back in place is as simple as poking a person on their hand. I mean, we're talking about super light force
We'll show that on the
adjustments.
model in a second, but let's rewind for just a second. Even before the birth trauma, which could be traumatic on a baby, especially when there's the need for, which can be certainly life-saving, forceps or vacuum extraction, because the baby has to come out, could be life-saving procedures. However, it can definitely put a little more trauma on a baby's head or neck, or even during cesarean section. But let's rewind a little bit to even before the baby is born. Can people have genetic predisposition to different spinal problems?
Absolutely. I mean, if you think about even children, mothers with scoliosis, their children usually have scoliosis.
We see it all the time. Grandma has scoliosis, mother has scoliosis. Well, guess what? The baby is more likely to have a genetic predisposition to develop scoliosis. If we can catch it before that forms, how fantastic is that for the baby, for the child and the
Absolutely.
parents
I mean,
and everything?
Definitely catching a problem before it occurs, that's our goal. We don't want, I'd rather you come in and get periodic checkups your whole entire life and never have an issue than crawl into my office crying with buckled over and back pain.
Right.
That's not, can we take care of you like that? Absolutely.
And do we have results? Absolutely.
But would I rather you get checked from birth and never, that's my goal. I'd
Definitely.
much rather you come in from birth, get periodic checkups, and live a healthier life forever, rather oh, I have this symptom. Now I want it taken care of.
And I like to think of genetics like this. You could take a blueprint of a house. You could take that blueprint into Home Depot and say, give me the cheapest, junkiest things you can give me to make this blueprint.
Mm-hmm.
Or you can go to the same Home Depot with the same blueprint and say, I want to spend the most amount of money, get the best things I can to build this house. Now you built two of the exact same house, but they're totally different.
Yeah, on the outside they look the same. On the inside, one's going to fall apart in a year.
By doing the right things for our body, genetics are a blueprint. Not just genetics with our spine, but genetics with everything, whether it's cardiovascular, or their pancreas, or digestive, or their lungs, or their spine. It's a blueprint for what our body could be like. The more healthy things you do, the more good things you do for a child, for an adult, for the system, changes what the underlying body is like.
So yeah, we talked about babies being born and the trauma of that. Let's talk about overall, once a child's born, well, then what do they start doing? They start learning to crawl and walk and all these things. And it's pretty traumatic if you just watch a life cycle of a child, an everyday occurrence of what they do when they're starting to learn to crawl, starting to learn to walk. I mean, if you take a little tiny baby, try to stand it up on its feet, it's going to plop down right on its butt.
Absolutely.
And it happens. You see a little baby, they're always trying to climb up on things. They're always trying to climb and they fall and they fall.
I have a 1-year-old that falls every day,
exactly.
Hundreds of times a day.
I mean, and these little traumas may not see anything. Oh, the baby cries, you pick it up, it stops crying. You think it's crying because it may have fell down, but we don't know what the underlying cause, what's going on, what happened to their spine with that fall, what happened to their hips, their pelvis.
And again, their spines are softer, so they can absorb a lot more of those blows. Their spine is about 40% cartilage matrix, where an adult's only about 25%. Huge difference, because an adult couldn't fall like a kid does. But look at, even when they're learning to crawl, as the baby's starting to grow and develop, crawling is so important for the development of the spine, because that's when we go from a C-shaped spine, that they start with in the womb, to an S-shaped spine with 3 natural curvatures. So I'll explain what the spine should look like in a normal position. I like to nickname these the arcs of life. We need to have normal curvatures or arcs in the spine to keep it in a smooth and relaxed position so that it's not stretching or pulling and irritating on the nerves. And the time that we do that is when we learn to crawl. And most of the time, parents are eager to get their kids walking, or, you know, floors may be dirty and they're not as big on crawling. Crawling is such an important thing that in our office, when babies come in, when parents come in, we encourage them to really help their baby crawl. We give them exercises at home to really influence the cerebellum.
Yeah, and it's not just the spine and the shape of the spine, it's neurological effects of the crawling. I mean, just that cross crawl that sends signals from your left side of your brain to your right side of the brain when you do that motion of crawling. I know a lot of people, even after auto accidents that have big major head trauma, they retrain them with these cross crawl exercises because how it affects the neurological nervous system.
And it's very important. So that's something that if anyone has questions, they can call our offices at any time, and we can give it a list of some exercises that people could do to help brain development in baby, help the crawling response. But as the baby learns to crawl, again, they go from this C shape to this S shape. The head has to come up, and it changes the structure. So it's important that babies crawl for a fair amount of time and not just skip crawling and learn to walk. We'll hear that a lot of times. People say, oh, you know, my baby, they didn't even ever crawl, they just started walking.
They're so advanced.
Yeah, they're advanced. That's not a good thing. Crawling is a very important step in neurological and spinal health and development. So we definitely want to make sure that we keep that going. And through chiropractic adjustments to newborns and infants really helps for that development as well.
Yeah.
And go ahead.
I mean, I know it's not a fun thing to watch, but we do have a video clip of showing children in everyday activities. You want to roll to that video clip?
Yeah, we'll show the video clip and just all the things that a child does on a daily basis and what that can actually do to a spine. You don't think of these little things that can happen hundreds of times a day.
Absolutely.
So enjoy the clip. So look at the thousands of things. My kids did half that stuff yesterday.
Yeah.
Right? You know, every kid does this. Every adult has done this as kids. So again, most people don't think they should even think about their spine because it's not hurting that bad. Look at some of these things and how they could cause misalignments or what we call subluxations in the spine that could be there and cause detrimental problems in their health later in life that they don't necessarily feel or hurt them. You know, there's some of those injuries, within 2 days they could feel better.
Yeah.
But underlying, they could now have some pressure in the nervous system or in the spine that says they're underlying. You take a door hinge, you kick it out of alignment, it's going to grind, it's going to rust faster. And the same thing happens to the spine. Parts wear out faster. When they wear out faster, that's degenerative osteoarthritis, wear and tear. So I want to show how gentle and easy a chiropractic adjustment to a baby can be. Some of the different things we can use, some of the different techniques, and how gentle it is. So some things we do to check the baby, to palpate, is what we use our hands to feel for misalignments. We just use our fingers, we run them up and down the spine, feel the neck like this. We can have the mother actually hold the baby, and we can feel it this way. One thing we do to look for the very top bone, which is called the atlas. We don't do this in every single baby, but this is something that's going to be a good diagnostic technique for us to see misalignments in the atlas. It's actually when we turn the baby upside down, which may seem a little crazy to most people, but how does the baby in the womb most of the time?
Yeah,
Upside down. They're actually used to being like that. And so we'll hold the baby upside down, and we see which side the head may favor. And that can tell us or indicate which side the top bones of the neck may be misaligned to.
There's a few other things for that same thing. If you see babies in their car seats, a lot of time they tend to always keep their head to one side. That's an indication that the spine is misaligned. There's a shift in the structure of that bone that direction, so it's easier for them to do it. Another one, if you look at a baby, sometimes it's easier for the baby to nurse on one side rather than the other. So maybe on one side you're like, oh, the mother has a problem. Did you ever have a problem with one of our kids nursing on one side rather than the other?
Not especially, but they were checked from minutes old.
Yeah, I mean, our kids were, but we've seen in our practice that a mother's like, oh, my baby only nurses on one side.
Or may not be nursing
Or not nursing at all.
Right.
So if the baby's
Not
only nursing on
latching
one
on.
side, there's also another indication as well as holding the child upside down.
And we will definitely see, we really encourage people to look at their car seat and look how the baby's head. If they are favoring one side, there's a term called torticollis that a lot of people may or may not have heard of, but that's something that we have great results with as chiropractors by working on the bones in the cervical spine and keeping them in nice, healthy alignment allows for some of those muscles to loosen up, relax, and a lot of times prevent the need for a helmet, prevent the need for the head changing shape. Because what happens is the head is cockeyed like this, and now because the bones in the skull, the sutures aren't fully fused,
Flattening.
they start flattening, exactly. So you see the babies with a different shaped head, and they have to wear the helmet. The earlier we catch that, the better. We give the parents things to do at home as well, some exercises to do with their babies as well to keep the head in normal, healthy alignment so that the head doesn't change shape, the neck stays healthy and develops at a normal rate.
You can even get one of those pillows you wear on the airplane and put it, they sell them for not that big, but for little kids while they're in their car seat. I mean, car seats don't have it, some do, that nowadays more and more are getting it like a collar basically, so when the kid's lying down, they can't favor
Prevent
one
the head
side.
from flopping back and forth. They
'cause-
can use rolled up burp cloths, all sorts of things to make sure we don't have the head flopping back and forth or favoring one side while
Yeah.
they're sleeping, or favoring one side while they're nursing, anything like that. So that's one thing that we absolutely look for. And then now that we do analyze or find things in the spine, let's say we find some nerves around this area here, a lot of times we can see that can have a big effect on colic. Colic is a term that many people have heard but don't really know what it is. It can be abdominal distress or abdominal pain that a baby can't really express or say this hurts or that hurts,
They
so
just
they just
cry.
cry uncontrollably. And so that can be not only rough for the baby, but rough for the parents. You know, parents that are already sleep deprived, and now the baby's screaming, crying, can't be consoled. And there are research studies after research studies showing how chiropractic care for babies can help with things like colic by keeping a more relaxed spine and nervous system so the baby doesn't have that abdominal distress.
So should we show the audience how simple and easy and light these adjustments? I know most people
Absolutely.
think, oh man, you're going to crack my little kid's neck. That's not the case. We have a bunch of different instruments and tools we can use
We don't hear
for
big popping sounds like we would on an adult. And the cracking sound itself isn't actually cracking. All this is depressurization of air bubbles and gas, CO2 and nitrogen gas of the joints. But there's you don't really hear much of anything. We feel it, but you really don't hear much popping or anything like that. And even like when we work on the pelvis, so gentle, it's so easy. You can take the leg like this, work on the ilium, work on the sacrum or tailbone, just like this, just light touches like this. Again, a lot of times the baby will just be laying right on the mother, instead of on our table, it's going to be laying right on the mother. We feel like this.
Mm-hmm.
We can lay like this. Feel their neck like that. They can be held up like this. And so we can show some of these different instruments and tools that we use as well.
And once they get a little bit older, we have this is a chiropractic activator. It basically puts an impulse. I mean, it looks a little hard, but let me
It's double
show you on
spring
this.
loaded.
So it's a spring, so basically
And then
puts
so
on her hand. So it's a little bit of pressure. It makes a little bit of noise. So when the kid gets a little bit older, you can just go find the misalignments and a little bit of
Or even
pressure.
we actually can put it on our own hand or on
Yeah.
our own finger to lighten the force.
So yeah, you can do it right there on your thumb. And then when they get a little older, we also have, this is a adjusting headpiece. So it goes a little up and then it just does a little drop. So the baby, you can wear it on put it on your lap and just hold the kid. And it's a little bit of drop with a little bit of pressure, and the results are phenomenal. So I mean, we're not doing any cracking, no twisting. There's instruments that we can use that are safe and effective, and the mother is not scared, the children don't get scared, and the results are there. So
And with something like chiropractic care for pediatrics, what do they have to lose?
exactly,
You know,
nothing.
Nothing. It's not going to hurt them. It can only help them. Even if it didn't help them, they had nothing to lose.
Yep.
It's not a big deal for them to get adjusted. It's not like we're doing an invasive procedure. They're not having surgery
There's
or
no
anything
drugs
like
involved. I mean,
Yeah.
you look at the numbers of drugs on the rise these days. I mean, they're huge, and there's so many studies showing that chiropractic care can help reduce the amount of drugs, reduce the amount of sick days that kids have in school, reduce all these things. So there's only benefits to being under chiropractic care.
that. Absolutely. We'd like to show another video of actually a 4-year-old girl being adjusted in the office and see how gentle and how easy it is for her during the adjustment and how much she really likes
Yeah,
it. Kids
she-
in our office love it. They
they
jump
enjoy
up on
it.
the table, and we try to keep things fun and light for the kids in the office. And so we'll show that clip and watch her get adjusted.
So as their children, it's so great for their spines and for their bodies to keep them in normal alignment, to keep their spine and their body functioning in an optimal position as they grow and as they develop. So here we have Sophia. Can you say hi, Sophia?
Hi,
I'm going to show you what it looks like for us to do a chiropractic adjustment on a child. I'm going to start off here. This is our chiropractic adjusting table. I'm going to place on here our little tabletop that we use a lot for children. Ready, Sophia? We can hop right on up here. Need some help? Here we go. So she's going to slide right up here. She's just going to lay facing down. Doing great. First thing a lot of chiropractors do is we like to check the legs. And here you can see with Sophia that her left leg is about 1/4 of an inch shorter than the right. And so the reason for that is that her hip is rocked backwards just a little bit. And again, they may have happened from daily trips and falls. A lot of times it happens directly from the birth process with children. So we're going to get up here. We're going to start really gently realigning just a few of her bones. Have an instrument here, which is very lighter force, high velocity, called the chiropractic activator. We're going to use here to help make our adjustment. And Sophia, can I get you to lay on your side here, facing towards me? What we're going to do here is just gently realign the lumbar spine and the hips and the pelvis. I'm going to lay it right on your other side here. And have you sit right on up. I'm going to check her neck. And the cervical spine is really the most important when it comes to her immune system. With children, we see a lot of children that we're able to help with things like ear infections, allergies, asthma, even the symptoms of things like ADD. And these nerves right up at the top control her eyes, ears, nose, throat, sinuses, brain function, and her immune system. So the more we can keep everything firing properly, the healthier she'll be. And that was it. She did great. Can you say goodbye, Sophia?
Bye, Sophia.
So you see, chiropractic for kids, it's very gentle, it's very effective. You see how she was smiling,
I mean,
she
she
was
was enjoying
giggling. It
that.
wasn't like it was painful for her or anything like that.
And one thing that I've noticed too is that parents notice symptoms that they didn't associate with the spine. Maybe less ear infections, they're sleeping better at night, less colic, those types of things. Have you seen that as well?
Absolutely. In fact, I was published in Journal of Pediatric, Maternal, and Family Health about some work with nocturnal enuresis, which is bedwetting for children. And that's a study I did a few years ago that I got published in the journal.
Absolutely.
And people would never think about that.
Absolutely. People don't think about that. Absolutely. You would never think in a million years, well, we do, but the general public never thinks, oh, my kid has bedwetting, there's something wrong with its spine. There's some underlying
Right.
structural shifts going on. But I mean, again, if we look at the spine and the nerves that are coming out, the nerves in your spine control everything for your heart, your lungs, your liver, everything, kidneys, bladder,
Obviously, if those nerves aren't
your
functioning
reproductive system, everything is being controlled by the nerves in your spine. So if you do have some type of spinal shift going on because of this, the way the birth process occurred, all these problems can occur and you have no idea because they're silent. You have these little symptoms that are occurring, but people don't associate. So our goal and mission is to go out to the public, go out to our communities, and just let people know what chiropractic can do for you and how it can help with everyday function.
So as a mother, what do you urge people to do with their children? And as a pregnant woman, what do you urge people to do during their pregnancy and with their children?
Just to go in and get checked and adjusted as you're needed the whole time from day one. Don't wait until you have these problems that you don't understand and use it as a last resort. Just start off strong.
Keep their spine as healthy as possible and their nerve system as well.
Yeah.
So thank you very much for joining us. This has been Ask the Chiropractor with Dr. Adam Rodnick out of Commerce Township. Remember that God gave you the gift of life, and what you do with that life is your gift back to God. I want to thank Dr. Rubenstein and Dr. Rubenstein out of Troy for joining us, and we'll see you next time on Ask the Chiropractor.